Hello, my name is Francesca Facco. I am a physician and researcher at the University of Pittsburgh, and I am the principal investigator of the Maternal Fetal Medicine Unit's SLEEP trial. Thank you so much for participating in our study. The sleep test you recently performed for our research study showed that you have sleep apnea. You have been selected at random to use a treatment called continuous positive airway pressure, or CPAP therapy for short. CPAP is the most common treatment prescribed to non-pregnant individuals with sleep apnea. Sleep apnea is a sleep disorder that affects the quality of your sleep and your daytime functioning. When you fall asleep, the muscles in your throat relax, like all the muscles in your body. Snoring is a common symptom, but not all women with sleep apnea snore. When you have sleep apnea, when you try to breathe in, the walls of your throat flop inwards, narrowing or closing off your throat so you can't breathe normally. When this happens, oxygen levels in your body can fall, and that can cause stress on your body. When your body then notices that something's wrong with your breathing, it causes you to wake up. This awakening is usually just for a few seconds, so you don't often remember it. When your body wakes up, the muscles in your throat start working again. They pull open your throat and you start breathing normally. However, waking up frequently can prevent you from going into a deep, restful sleep, so people with sleep apnea are often very tired the next day. A CPAP device is made up of a blower that blows air through a mask to your nose or your nose and mouth and into your throat. By making the pressure inside of your throat positive, CPAP acts like a splint to prevent your throat from closing while you sleep. The good thing about CPAP is that if you use it nightly, it will improve how you breathe at night. Most people who use their CPAP machine report that they get a better night's sleep and feel much more rested during the day. However, there has not been a lot of research on how CPAP may benefit a pregnant woman. In this study, we are trying to understand if using CPAP can help a new mom like yourself have a healthier pregnancy. We hope that by improving your breathing pattern and oxygen levels at night, CPAP may also reduce your chance of having issues during pregnancy, such as high blood pressure. The CPAP machine that we are using for this study is specifically designed for women, and it is classified as an auto-PAP, meaning that it will detect the amount of pressure that a specific user requires with each breath and automatically adjust to deliver just the right amount of air pressure to you. In other words, it is designed to pick the air pressure that is just right for you. In addition to CPAP therapy to treat your sleep apnea, there are also some general practices that might help improve your sleep and potentially reduce the number of apneas you experience throughout the night. Some of these practices include making sure you're allowing yourself 7 to 9 hours to potentially sleep each night, maintaining the same bedtime and wake time routine, limiting caffeine consumption, particularly in the afternoon, and limiting your screen time before bed. It is also important to make sure that you are not overnapping during the day. Ideally, naps should be limited to 20 to 30 minutes and should not be taken in the late afternoon or evening. Sleeping well during pregnancy can be a challenge. There are common physical symptoms like the frequent urge to pee, heartburn, back pain, or nasal stuffiness that can make it difficult to fall asleep or stay asleep. Finding a good sleep position is important. Lying on your side with your knees bent is likely to be the most comfortable position as your pregnancy progresses. It also makes your heart's job easier because it keeps the baby's weight from applying pressure to a large vein called the inferior vena cava that carries blood back to the heart from your feet and legs. Some women use pillows placed under their abdomen or between their legs to help them get comfortable with side sleeping. Using CPAP therapy can seem like a challenge to many at first, but the more you attempt it and use it each night, the more your body will adjust to it. Most people who get into the habit of using the machine every night say that they have more restful sleep and feel better during the day. For you to get the most possible health benefit from CPAP, it is important that you try to use the machine every single night. Put the mask on when you are sitting in bed, getting ready for sleep, and try to relax, getting used to the mask and finding a comfortable position for sleep. For our study, your CPAP use will be monitored on a weekly basis. The CPAP machine has a built-in wireless modem that will allow our central reviewing center to see your usage information. This modem is an independent connection, and you do not need to have Wi-Fi or any other type of internet connection at home for this to function properly. Through this monitoring, you will have the possibility of earning up to $20 per week if you are using your CPAP consistently while you sleep. At your weekly research assessments, if your usage is averaging more than 6 hours per night, you will be paid $20 for that week. If your usage is averaging between 4 and 6 hours per night, you will get $10 for that week. But any week where the average usage is less than 4 hours per night, you will not get a payment. These payments are in place to help keep you motivated to use your CPAP regularly. But remember, using your CPAP regularly also could have health benefits for you and your pregnancy, so that should also keep you motivated. A properly fitting mask is an essential part of adjusting to CPAP therapy. You have already chosen a mask, but if you find that it is not a good option for you once you start to use the machine, a different style and size can be provided. The CPAP machine that you are being provided has features which will make it more user-friendly. A key feature is the humidification chamber. This helps moisten the air that is being delivered to you and helps to prevent a dry nose and throat. For convenience and optimal functioning, the CPAP machine should be plugged in at all times. The supplied power cord should be connected directly into an outlet, and the other end plugs into the back of the machine. The best placement for the CPAP machine is somewhere that is close enough to wherever you sleep that the hose between the mask and the machine is not pulled snug. It is also best to place the CPAP lower than the level of your head when you sleep. Most users place it on a nightstand or a side table. When you are preparing for bed, you will most likely find it easiest to incorporate putting on your CPAP mask into your nightly routine. If you have any nightly rituals such as reading or lying in bed watching TV that often leads to falling asleep, you may want to put your CPAP mask on while doing these activities. Ensure that your mask is on securely but not too snug that it will be uncomfortable. Once the mask is secure on your face, the machine will automatically turn on by itself once it detects breathing. If for some reason the machine does not turn on, you can do a manual start by simply pressing the Start/Stop button on the top of the machine. Ensure that the tubing is securely connected to both the mask and the machine. Should you need to get up in the middle of the night, you can either detach the mask from the hose or take the mask completely off. While we encourage smoking cessation for everyone, especially during pregnancy, we are mindful that some people do continue to smoke. If you do smoke, it is very important to remember not to smoke while wearing your CPAP. When you wake up in the morning, you can simply take the mask off and the machine will stop delivering air on its own, and it will be ready for your usage the next night. The clear section that is on the right hand of the machine when you are facing it is the humidification chamber. Before bed, pull this chamber off of the machine, pop it open, and fill it with water to the indicated line. Close the lid and push the chamber back into the machine until you hear a click. Your CPAP machine will use this water to help moisten the air that is being delivered and will help to prevent you from experiencing dryness. If you're still experiencing dryness, let the research team know and they can adjust the humidification. Each morning, your CPAP machine will display some information about your usage, such as how long you used your CPAP machine that night and how well your mask fit. A smiley face indicates that you had a secure fit on your mask with minimal leakage throughout the sleep period, but a frowny face indicates a large leak or a poor mask fit. If your mask fit icon is a frowny face, try adjusting how secure your mask is on your face the following night. If it is still displaying a frown, contact a member of the research team for help in troubleshooting. More information regarding your usage, therapy data, as well as some helpful resources can be found through the MyAir app. We will set up a free account for you today so you will have access to your own information and you can track how well you are doing with CPAP. The MyAir app can be downloaded onto an iPhone or iPad for free through the App Store. If you do not have an iPhone or iPad or would just rather go through the internet instead of an app, MyAir can also be logged into online through any computer or phone. The MyAir app will allow you to track your CPAP use over time, give you feedback on what you might do to make things go better, and has videos that can be useful on things like how to adjust your mask or deal with other common problems. We have also recommended, if you are agreeable, that we provide the MyAir system with your mobile device number so they can send you SMS text messages about your usage, reminders, and helpful tips. The SMS text messages can always be opted in or out of at any point in time. Your research staff will now give you your CPAP machine, and you will practice using your mask, your machine, and the humidifier. We will be calling you in a few days to see how you are doing, and we will arrange a 1-week follow-up visit. In your CPAP machine bag, there is a cleaning guide. We will go over the details of how to clean your equipment at your 1-week follow-up visit. After the 1-week visit, we will be touching base with you weekly to see how you are doing with your CPAP usage and see if you are eligible for payment. In the 3rd trimester, we will be setting up a follow-up visit with you with the research staff. Thank you very much for participating in our study, and please don't hesitate to ask any questions or raise any concerns you may have with your local research staff.